Hey everyone, welcome to another episode of Cerner Hacks. In this episode, we're going to cover the discharge of a patient, how we can do this most effectively and not miss any steps. So stay tuned. Okay, welcome back. So now we're ready to discharge this patient. We've worked really hard to get her stabilized and finally she's ready for discharge. Now what? So there are three main steps that we need to discharge a patient. First of all is completing the discharge documentation. Second of all, we want to do the discharge medication reconciliation. And finally, we want to put the discharge order into Cerner. All right, let's tackle this one by one. So the first thing we talk about is the discharge documentation. As you can see here, the hospital course is filled out already. And this is where your hard work shows when you've been diligently updating the hospital course while you're rounding on the patient on a daily basis. This is also, as you recall, a share field between multiple providers. So they will hopefully contribute to this hospital course as well. And so when you're going to do the discharge documentation, this will be the easiest part of the discharge, hopefully. So in this hypothetical example, we have Mrs. Smith, who's a 77-year-old lady who came into hospital after a 3-day history of pleuritic right chest pain. She was diagnosed with pneumonia and a pleural effusion. She initially required some oxygen and completed IV ceftriaxone for 3 days and is now stepping down to clavulin to complete her course as an outpatient. I pre-filled a lot of these fields to save us some time. Significant findings, including a chest x-ray and the fluid analysis from the thoracentesis, the procedures, which is the thoracentesis, the assessment plan she's resolving with antibiotic treatment and finishing clavulin, going home, post-discharge follow-up with her family doctor to do the labs and chest x-ray in 10 days, and the patient instructions to follow up with family doctor for 2 weeks for the results of the chest x-ray and labs. One thing I haven't done here is the chest pain on breathing. This was an initial diagnosis in the emergency department, and I want to make this more specific to convey more information, and we want to write lower lobe pneumonias. So how do we do that? We go into the discharge diagnosis, chest pain on breathing, and we can modify. So you can see that the diagnosis is chest pain on breathing, but we want to display as right lower lobe pneumonia. Okay. And now we can save that. Okay, so we've done most of our discharge documentation, but we're not going to do the discharge summary yet. You can create the note here. What we're going to do next is we're going to go through the order profile and see if there's any outstanding issues that we might need to address as an outpatient. Let's say everything was okay. And now we're looking at the Discharge Med Rack. So we can see here the ceftriaxone is still on board. We want to send this patient on home on clavulin. We don't see clavulin here. So what we're going to do now is add clavulin. We'll go to quick orders here and new order entry. There's a variety of ways of doing this, but let's do it this way. We're going to do the 250 clavulin dosed TID, and we'll modify this order. And since she's had her ceftriaxone today, we're going to start this the next day. So in this example, the date would be for tomorrow, and we'll start that 0900. And we're going to sign off on that. The reason why we do this is so that it will pre-populate the discharge summary when we do the Discharge Med Rack. So as you can see here, the discharge medications now have clavulin on it. It also has a ceftriaxone, but we're going to deal with that when we do this Discharge Med Rack here. So this is the Discharge Med Rack screen. As you can tell, this green arrow means continue, that you're not going to prescribe the medication. The pill bottle icon, which means creating a new prescription for that patient. Stop, we want that patient to stop the medication. So let's go through some of this together. We want her to continue her home lisinopril. You can see from this icon, it says that this ramipril was substituted for the lisinopril, and so we're going to stop that. Metformin, for purposes of teaching, I'm going to discontinue that. We will continue her multivitamin, discontinue the Centrum, discontinue the rest of these medications, but continue her clavulin. And here they may ask us to write the dose again. We're going to put 1 tab PO/TID 4 days. And as you can see, it already pre-calculates how many tablets she'll need. Don't forget to select the routing. This will be to your local printer. So to complete this in our training environment, I'm going to just pick this one and we're going to sign off on it. So now we can see our Discharge Med Rack has been completed. The prescription will automatically shoot out to the local printer. Now it's time to complete our discharge summary, and you'll see why that we wanted to do the Discharge Med Rack before clicking on this button. As you can see here, we'll scroll down the information has been pulled in from the work fields. So you can see here, this is a medication reconciliation that we did just now. It put in the clavulin, 1 tablet 3 times a day. Note that Cerner didn't pull in the number of days on this Med Rack, so we're going to have to type it in. However, on your prescription, it will say 4 days on it. You can see here that we want them to continue the lisinopril and the multivitamin, and we've discontinued metformin, let's say due to acute renal failure. Alright, so you can see here the hospital course has been pulled in. Other things have been pulled in, including our exhibited findings, procedures, discharge disposition on our follow-up. Alright, so let's scroll back up to the top. We'll have to complete some of these fields that didn't get filled in earlier. So we're going to say right low lobe pneumonia and improving on antibiotics. We want to make sure these are accurate. Chest pain on breathing is not a chronic problem, so we'll delete that. And historical problem, delete that. And we can fill in these as well. Relevant specialists. Here at Lionsgate, we do have an auto text that we can pull in. I've called it consultants. And to learn more about auto text, refer to my video about auto text that I'll be putting out shortly. And significant findings. There's another auto text that we can put in called x-rays. Clean that up a bit. Alright, sign off on this document. If there is a family doctor, it will automatically get CC'd to that physician. You may have to search for other providers if there are other providers that have looked after this patient in hospital. And after we've done that, we'll sign it off. And we go into a document section here and refresh it. We're going to see our discharge summary. So we've completed 2 of the 3 things that we needed to do to discharge this patient. First is our Med Rack. Second is discharge documentation. Lastly, we want to discharge the patient from Cerner. And what we want to do here is go to quick orders and go into patient disposition and discharge the patient. So now when we go back to our order profile, you'll see our order for discharging the patient. The last thing we want to do is print out the lab rec and the x-ray for the patient to take home. To do that, we go into outpatient imaging. We want the chest x-ray and we want the labs. We're going to modify the orders. And you can see here as we scroll down, we want future orders, frequency once. Let's say I want it in 1 week's time. So we're going to click this day here and we want the chest x-ray on the same day. So we're going to request the start time to be on the 5th and we're going to say follow-up pneumonia. And then down here we want to put in our family doctor's name as well as making sure it's a future order visit. You also want to put the family doctor's name in there to make sure that they get the results as well. So we're signing off on these. What will happen after you sign off, that will get printed to the local printer and you can give those to the patient. So let's go back into the discharge tab here and we're going to entertain another scenario that this patient is now, instead of going home, will go to a facility. If they are going to a hospital with Cerner, nothing else needs to be done differently. If they're going to a hospital or facility without Cerner, what we then have to do is print off a discharge medication reconciliation so they can order the medications that we have at discharge. To do that, double click on the encounter number. So what happens then is it gets copied onto a temporary clipboard. We next go into the Cerner reporting portal. We'll open that up. The first time you open this will take a little time. Just be patient. And the type of report we want is the discharge medication order summary for patients returning to residential care. This is also the same report that we would use to transfer a patient to a different hospital. I've starred this to make a favorite so it's easy to find next time around. We'll click it once and we'll run this. Here is the encounter number, and what we will do here is right click and paste that number. They only want the encounter number and not the letters here, so we'll delete the rest and execute. This doesn't display because we're in a test environment, but what would normally show here is the medications that have been prescribed, and it'll ask us to continue them. And when we print this off at our local printer, we can sign off on the ones that we want and discontinue the ones that we don't want manually, so that the facility that's receiving the patient is quite clear about what is to be continued. Okay, that sums it up for discharge a patient. Hopefully that was helpful, and we'll see you next time.